This video is to show people who've had a very recent strain or very inflamed turf toe. And if you're a turf toe, meaning that when you're going into extension of the toe, you're getting a lot of that pain around this joint right here, then this video is for you, okay? So the first, what you start with is, I like it stabilized on something. You can have it on your own leg if you're flexible enough. If you're sitting in a chair, if you want to put it on something, wherever it has access where you have your hands at your disposal is best, okay? And I'm gonna just lean over here so you guys get a better angle. But again, I'm pretty flexible, so you don't have to do it like this way. Now, first, you wanna stabilize at the foot part, at the midfoot, okay? Like so. And you take the other hand, and I'm gonna make this as non-technical as possible so you guys understand. And take the other hand, you're gonna take the big toe here, past that middle joint. So we're not working on that one in the middle, we're working on this one, the one that attaches to the midfoot. Okay. You're gonna just circle around it and just start first with traction. So what that means is you are just pulling outward. Okay, we're not adding any complexity to this, just pulling outward. Nice and gentle. So you can feel where the joint you'll feel the capsule inside the joint stretch a little bit. You're gonna feel that stretch, and then you're just pulling into that capsule, just nice and gentle. If you're having, I don't have turf toe right now, but if you're having turf toe, this could be very painful. You wanna elicit maybe a 3 or 4 at max out of 10 pain, and 10 being you have to go to the hospital, and 0 being absolutely no pain at all, okay? A 3 or a 4 at maximum, all right? So again, you get onto that capsule here of the joint, you feel a little, and it's very slight, you feel a little restriction, then you go out, and you can just pulsate forward, do it maybe 10, 15 times in a row. Second version of this, same thing, you're tractioning, but you add a little bit of rotation. So traction out, a little rotation, and then same thing, same move. You can do both ways. Twist the other way out a little bit and then pull out. Not really hard, okay? Now we're gonna do technique number 2. You're gonna take, I want you to see my thumb as a good example. We're gonna stabilize here, then move here. In this joint, you're gonna try to pull out and mobilize here and mobilize here. So below and above. Okay, very simple. So if you take a look at mine, I'm gonna stabilize, same grip, but I'm gonna keep my thumb on the underside because I'm gonna mobilize it dorsally, or if this is my flat foot, upward. I'm also gonna mobilize it downward. Okay, here, pull, and push, and push, and push. I'm still keeping traction out this way, out, using my thumb, and I'm mobilizing out. Okay, and then same thing on the other side. And I like to use maybe the inner part of my hand here. It doesn't really matter as long as you get a good stability here on the other side. And a good block, and that way I feel it moving downward, nice and gentle. And this is also another one you can add a little bit of rotation. So a little twist, just a little bit, pull out, and you can push into the same directions of that mobilization. Those are 2 different techniques with and without rotation that you can use for some very acute inflamed turf toe. You can check out my other videos for other progressions and other exercises you can do for that particular diagnosis.